Okay, well, thanks for the introduction, John. As it's been said, my name is Jamie Moore. Today, I'm going to be talking about non-response bias prevention and adjustment in a national longitudinal COVID-19 survey. Full range of authors on here from ISA. Author contributions are equal, but I'm the one that's presenting, so I'm the first. Right, nearly pressed the wrong button to change my slide there. Okay, so you know this bit apart already. The UKHLS main survey is a multi-domain longitudinal survey of the UK population. Started in 2009 with a probability sample of households. There have been subsequent boost samples with that, 2 or 3 so far. Yearly interviews, multi-mode, face-to-face, telephone and web, with a mixture of fixed and rotating items. Some items are presented every year, some items every couple of years or so, some of them are one-offs. Now, given the COVID pandemic, there was a need for more, timely data. So we managed to get the money to run what turned out to be a roughly bi-monthly survey. It's been running, well, basically since I think the first one was in March 2020, primarily web-based. We've now run 8 waves, and we've got a final one in the field about now. In each of those waves, well, in the first wave rather, or the first responding wave, respondents were asked baseline items concerning what was going on in January and February 2020 in their lives. Otherwise, much the same as the main survey, it was a mixture of fixed and rotating items across waves. Now, this survey, the UKHLS COVID-19 study, has been a major information source on the impacts of COVID-19 in the UK for both the government and others. If you follow that link, you'll see a list of the publications that we've picked up on so far. Oh, damn. Right. Now, one of the aspects of the project was to try and minimise non-response biases. Now, survey non-response is common. It tends to be higher with web interviewing. May also have been higher in the COVID study than during the UKHLS main survey, because we had very short data collection periods. We were only open for about 10 days with each wave. Now, if this non-response is differential across sample subgroups, causes non-response error, survey estimate non-response biases, i.e. deviations from the population value. This reduces the quality of inferences about the study population, so it's something that needs to be reduced if at all possible. There are methods for reducing biases can roughly be divided into 2 groups, both of which we sought to use in the COVID-19 study. The first of these is bias prevention, which is the use of methods during data collection to reduce biases. The second one's bias adjustment, which is the use of methods after data collection to reduce non-response biases. In this talk, we describe the aspects of the survey design and evaluate their performance. Now, in terms of bias prevention, basically the aim here is to produce a survey data set with the same attributes as the study population. Our study population is the UK adult population, so that's what we're trying to reproduce with our survey data set. Now, we tried to do this in several ways. First of all, we used an eligible set of subjects from the UKHLS main survey wave 9, which is 2017-2018, from households in there, working on the theory that would be reflect the population, given what we've done in terms of like the probability sampling before in the main survey. The second aspect, I mean, this goes on in pretty well all surveys anyway. If people didn't respond initially, we sent multiple reminders to them to try and get them to respond. Now, the third part, to do with mode. So as I say, given the way that things went with the pandemic, the fact that we couldn't do face-to-face interviews, the survey was primarily web-based. But what we did manage to do is get some extra money to survey some of the non-regular internet users that didn't respond to the web survey by telephone. Now, given this, we ended up with 3 partly overlapping sample components. First of these were regular internet users issued the web survey. I should say that we identified the regular internet users from information that we gained from the main survey. The second sample component, non-regular internet users that were issued the web survey. The third sample component, now this is the one that partly overlaps with the second sample component. It's non-responding, non-regular internet users who were subsequently issued to the telephone survey. Now, to evaluate performance, we quantify how respondent UKHLS main survey wave 9 measured socio-demographic characteristics from each of the components in the COVID survey wave 1 dataset compared to each other and to the eligible set from which they were drawn, i.e. those that were issued the survey. Now, first of all, let's just have a quick look at some sample sizes and the response rates for wave 1. Now, N eligible is the eligible set. So basically, we issued the survey to about 44,000 main survey respondents. Of these, about 35,000 had main survey information, and more importantly, main survey weights, which we'll need for the second part. We need a main survey weight to produce the COVID survey weights. Of these, about 2/3 of them were regular internet users. We got about a 50% response rate out of these. They all had wave 9 information, obviously, and they all had wave 9 weights. Response rate, again, about 0.52. The second sample component was the non-regular internet users that were issued the web survey. So there were about 15,000 of these. Far fewer of these actually had wave 9 information. I mean, part of the thing was they were the ones that said that they weren't regular internet users. They were also the ones that we didn't have information about that question for, were put in the non-regular internet user category. We got far fewer respondents with these. It's only about 15–16%, even less when you boil that down to respondents with wave 9 information and wave 9 weight. The final sample component, so this is the overlapping one because they're actually the non-respondents who were non-regular net users, web non-respondents. We were limited in terms of money, so we could only sample a random subset. We issued to about 3,400 of them. A lot of these had wave 9 information and weights. We got a higher response rate with these than we did when the non-regular net users issued to the web, about 21%. This rate actually increased a little bit more when you just restricted it to the number to the people that had wave 9 weights and information, or wave 9 weights anyway. So, and then we look at the final category there. This is everyone together. So this is where all the web respondents plus the telephone respondents. In total, out of those 44,000, we got about 18,500 who responded. It's an overall response rate of about 0.42, slightly higher again, 0.48, when we're just talking about people with main survey information. On to the next slide. Now, this is a bit of a monster. I'm hoping that you can see this better than me. I'm discovering I'm getting older. My eyesight's going on me, I think. But I'll try my best for this. Right, so this table addresses how selected respondents are from the different sample components compared to relative to the eligible set. To say, main survey wave 9 measured subject characteristics are considered, requiring that we focus on the eligible set subjects with that information. The leftmost column, labelled 1, gives descriptive set of statistics for these subjects. This is the target group, as the IPW weights released with the COVID-19 study are derived given the wave 9 weight. Put another way, if we were able to retain response from all these subjects, we wouldn't have to adjust the main survey weights to produce a COVID survey. Now, the narrowest data collection strategy is issuing to regular internet users. This is column 2 in that table. Relative to the eligible set, respondents are more likely to be aged below 70, more likely to have higher education, less likely to be Black, Asian, minority ethnic, BAME, less likely to live in social housing, and they have higher incomes. These imbalances will need to be addressed by weighting. Comparing column 3, non-regular internet users, to column 2 reinforces this point. Relative to regular internet users, these respondents are older, less educated, and more likely to be BAME. Thus, issuing to all eligible subjects, not just regular internet users, leads to a slightly more balanced data set. Column 4 shows that the telephone respondents are even older than non-regular internet user web respondents and even more likely to be less educated. They also have much lower household income and are more likely to have long-standing health issues. Hence, adding these respondents to the data set should further improve it in terms of replicating the eligible set. Column 5 then illustrates the combined effect of our bias prevention methods, which are a broader invitation strategy and mixed mode data collection. The resulting data set is more similar to the eligible set in terms of observed variables than the data sets results from resulting from the narrow invitation and data collection methods. Nonetheless, this data set is still better educated than the eligible set, less likely to be in social housing or to be BAME. Hence, even with this data set, without adjustment to the main survey wave 9 weights, we're unlikely to be able to maintain satisfactory population inferences. Now, in terms of bias adjustment, I've mentioned it several times already. We reduced the biases remaining after data collection by releasing inverse response propensity, IPW weights, scaling response to the UK population with each wave of the survey. There are different variations on this. We produced in both the web and telephone. We produced cross-sectional weights which just scale a single wave to the UK population. We also produced longitudinal weights that scale people who have responded to multiple waves to the UK population. Now, key to this is the fact that we've drawn the sample from the main survey, because it means, as I've again mentioned on several occasions, we can use the main survey weights and the fact that the UKHLS main survey is derived from a probability sample and also it has been shown to actually accurately reflect the UK population. Now, we adjusted the UK weights to take into account non-response to the COVID survey. So in effect, what we did was we modelled response probabilities conditional on wave to the COVID survey, conditional on wave 9 response. We used a Provit model with main survey wave 9 predictors, because we had those for the non-respondents to the COVID survey as well as the respondents, with a priori variable selection for the model using a lasso procedure with logistic regression. To evaluate performance for the wave 1 data sets, we quantified weight variability with CVs and estimate various inflation with Kishi's death. I'll note here, when I talk about the different data sets, they're slightly different from what I did before, because what I'm doing, the 3 data sets, regular internet web respondents only, all web respondents, regular internet users or non-regular internet users, and then the 3rd data set is the 2 combined, the web and the telephone survey together. In addition to Kishi's death and the CVs, which basically measure variation in weights, they both do that, I'll come back to that. We compared the weighted variable estimates given the COVID survey weights, the main survey weights, using a novel statistical test given that compares estimates given partial sample dependence. I'm not really going to go into this now because I don't have time. Think of weighted paired t-test with zeros if you're not in the data set. If anyone wants to ask questions, we'll come back to it afterwards. Right, now, given my time, I'm going to drop this one, I think. Right, now, let's have a look at these CVs and deaths. Now, the first point I should make about these is within the calculation is the variance of the weights. Now, the variance is going to increase with sample size. So if we actually look at this, regular internet users the all web data set has a slightly larger death and CV than the regular internet user data set only. This could conceivably be down to the increase in sample size. Key take home from this slide is the fact if you look at the data set together, the web and telephone data set combined, both the death and the CV are lower than they are for both of those, which you wouldn't expect with the increased sample size. This basically means that we would expect the inflation in variance caused by using weights to be less for the web plus telephone data set than we would for the web data set, web survey data set, and the regular internet users data set. So it actually means the web plus telephone data set's better. Now, here we are. This is the results of those tests. 3 data sets again. For leftmost column is the wave 9 estimate. The differences are the difference between each of the weighted estimates for the 3 data sets and that estimate. Now, if you look at it, it's not a huge amount of difference, but what we're definitely seeing is a slight increase in the quality, a reduction in the biases as we move from left to right across that table, i.e. as we move to a larger data set, and particularly when we add the telephone data set to the web survey. What I'm getting at is we need the telephone survey to produce a data set of top quality. So I really can't read off this screen at this point, so I can't really pick those in and out, I'm afraid. Sorry. Move on to the next one. So that previous slide, those variables were in the IPW model. They were in the response propensity model. So you might expect us to match those fairly well. These variables here are not in the model. They're still wave 9 variables, so they're not COVID survey variables, but they're not in the model. Similarly, again, we see a similar pattern moving left to right. As we add to the data set, as we add the non-regular internet users to the regular internet users, we see maybe a little bit of an increase. Not much. They're actually pretty well similar. Where we see the increase in data set quality is when we add the telephone survey respondents into it. So I reiterate, we need the telephone respondents. Now, this is just a slide, just basically some estimates from COVID study wave 9. These are the COVID study variables weighted by each of those 3 sets of weights I produced for those 3 data sets. Point is here, some of them, you don't see a great deal of difference. I mean, for example, I think it's on benefits doesn't change at all. It's 0.14 for all 3. With others, we do see differences in those point estimates. So if you do use the different weights to different data sets, you're going to get different estimates. Right, okay, so I'll just summarize now. So we use both bias prevention and adjustment to reduce non-response errors, survey estimate biases in the UKHLS Covid-19 study. Evaluations of the wave 1 data set show that the strategy performs well. Telephone follow-up, bias prevention, increases unweighted data set quality compared to regular net users only. Moving to the IP, onto bias adjustment, IPW weighting further reduces the biases left after data collection, most effectively in the web plus telephone data set. There's a few points with this. One, I think, given that we put this together and pretty well, what, a month or 2, something like that, and we've been constantly working at this. As I say, we've got 8 waves so far, and we've got another one in now. I think it shows that it is possible to actually produce a survey that will actually reflect population estimates and allow population inference, as long as you use appropriate methods. So running through these, drawn from the main survey hubs, we've got the weights there. We can use those to actually scale things up to the population by adjusting them. It also allows us to bring in all the information we've got from the main survey about how the main weighted estimates from the main survey actually reflect population estimates. We can build on that. There's also the methods, obviously. We've been doing this for 10 years, but a pretty fair idea of what was going on. We were in a position to take this on quite well. So yes, it is actually doable, given these certain things, bias prevention, bias adjustment, even in such a short time scale. And the second point, it might be all about this survey, but it may be a little bit more going for a question going further forward. So interestingly, web sampled non-regular net users, there was a bit of a data increase in quality, but it wasn't a massive one. In some ways, it actually looked like there might be a reduction in quality by including them, the variance in inflation estimates. Now, we don't know that for certain there, because I haven't actually in this study compared a regular internet users data set, web respondents data set, to a regular internet users plus telephone respondents data set. So we don't know that direct comparison from what I've shown today. Also other questions there. I mean, the obvious thing we're looking at here is, could we actually drop web sampling non-regular net users? If they don't improve the data set, could we use those resources elsewhere? For example, sample more telephone more people on the telephone. There's various other questions there, which I'm not going to address in this talk. One is, if we kept on sampling people by telephone, would we keep on getting would we actually keep on getting responses? There's another question with this, which I think probably means that we couldn't do it in this case, but going forward, it's potentially an option. So the problem is, as you can imagine, telephone surveys are actually 21.7 times the cost of the web survey. So if you actually calculate this through for what I've done here, if we dropped trying to web sample non-regular net users and instead use those resources to increase our telephone sampling, we'd sample about 700 more individuals by telephone, which would give us about 140 interviews, versus we get 2,250 web interviews from non-regular internet users. So at this point, and with the COVID survey, I don't think we could do this thing. But one thing I am wondering about is going forward. Certainly, I know Understanding Society is considering, rather than, or in addition to face-to-face surveys, doing face-to-face surveys via the web. That makes it a bit different. Okay, you might save on petrol costs, but you're still employing an interviewer over the web. At that point, I think these adaptive design questions where you ask, should I be doing telephone surveys over a potentially slightly less costly web survey, becomes very important. Okay, thanks for listening, and I'm looking forward to any of your questions. Thank you.